This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. Steve Love along with Thomas Miller. And we're going to begin our show today as we continue our discussions on COVID-19.
Well, this has been a journey that we sure did not expect when we started talking about doing this show. But, it's been so relevant as we follow this thing week by week and each little phase that we've been covering here. And now we're talking about moving the state of Texas more toward opening. Are we ready?
Yeah, absolutely. We heard the governor this past week, and I'm sure yesterday there were people that were in barbershops or in hair salons, maybe getting their nails done. We know in a couple of weeks, some of the gyms are going to open up, some of the non-essential manufacturing businesses. So there's quite a bit that is beginning to happen here in Texas.
Where are you in that spectrum personally? I mean, did you go get a haircut this weekend?
No, I didn't. I got a haircut, but my wife did it at home. I'm in one of those high risk groups. I tease a lot about saying I'm an old guy, and I truly am. So for that reason, I am being extremely careful. So no, I'm first weekend out. I'm not going to go get a haircut. It doesn't mean that it isn't safe, but I'm in a high risk group. I'm going to wait a few weeks before I do that.
Yeah, I'm in there with you and doing the same. So what are you looking at that will be some tipping points of information that you're going to have your eye on over the next couple of weeks?
Well, Thomas, based on discussions I've had with the experts, the incubation period could go as high as 14 days. And so I really think as we open things up, and we're opening quite a few things up, we really need to watch at least 14 days, maybe 3 weeks. And the things I'm going to watch, we're doing more testing. So you're probably going to have more tests come back and more cases. But what's really important is how many are you doing and what is the percent of people that are positive? Another thing that's extremely important, most of the testing we've done thus far is when people exhibit symptoms. Really, you have to start testing people that aren't exhibiting symptoms. And then, of course, if you do find problems, you have to do extensive contact tracing. So I'm going to look at admissions coming into hospitals. I'm going to look at the people that are admitted. Do they go to ICU? Are they going to need a ventilator? I think there's so many things we've got to look at. There's so many moving parts. Those are going to help determine, for me personally, when I kind of get more back into the public.
You mentioned the most ominous part of this to me, those 14 silent days. How do we reignite this, knowing that some people around us might be in that 14-day window and contagious?
Well, one thing that you can do, and I know this sounds pretty basic and pretty elementary. Obviously, if you go to the grocery store, you don't know everyone there, and you hopefully are going to be wearing a mask and potentially gloves. But if you're now going to visit family members you haven't seen in 4 to 6 weeks, maybe they aren't your immediate family, but they're family or friends you haven't seen, I suggest take a little notebook with you. Put the date, the time, and the names of the people that you're around. And then if for any reason you find out one of those people, or unfortunately yourself, contracts COVID-19, you've already got a list of some of the contacts, the dates, and the times that'll be extremely helpful when you do contact tracing.
And the younger people today do that in their phones.
Well, it doesn't matter. Yeah, that's right. I'm an old guy. I'll have a pen and a notebook with me, but do it in your phone. But really, all kidding aside, sometimes you forget all the people you've seen or people you've come in contact with, even if you do practice safe distancing. I think it's a good idea to keep track of that.
Now, that's an excellent suggestion. Great suggestion. Okay, now you are the president and CEO of the DFW Hospital Council. What are you hearing from your clients?
Well, the hospitals are really looking at this from 2 or 3 different angles. First and foremost, the the hospitals are here to serve the people, and they want to do everything they can do in prevention and wellness to prevent people from contracting COVID-19. So they're going to certainly continue to advocate wash your hands, wear a mask, social distancing, do the things from a personal hygiene point of view and personal habits to help prevent it. Secondly, if you do contract it, the hospitals are here if it's required that you go to the hospital. And you may not need to go to ICU, but if you do, they'll be there. Hopefully you won't need a ventilator, but if you do, they'll be there. So they're there from the health point of view, whether it be prevention or treatment. Now, the other thing that they're trying to do is focus on things other than COVID-19. There are other health issues that we have to deal with. And so they want to make sure that if you've got cardiac problems, unfortunately, if you've had a stroke, if you need to have surgery, even if it's elective, it could be urgent, it could be important, it could be related to diagnosis and treatment of cancer. They want to be there so that they can do that. The third thing, and let's be candid, hospitals have to look at their finances. Hospitals are some of the largest employers in many of the communities. We did an economic impact study, and hospitals inject close to $15 billion into the economy of North Texas. They want to make sure that they are healthy economically as well. This COVID-19 has cost hospitals a tremendous amount financially. They've lost a lot of revenue because people, we postponed elective surgeries and things got real expensive, especially related to PPE. So that's what I'm hearing from hospitals. What can we do to help prevent? How do we treat? How do we diagnose? And how do we become good stewards of the finances so we can be an integral part of the communities we serve?
I'd like to just ask you your personal thought on this. What does it look like if this reopening is done successfully?
I think, number one, if it's done successfully, we should all be very thankful. But I think even with that, what it's going to look like, we still are going to have to kind of wait, watch, and see exactly how this virus is reacting. If we come through this successfully and we get things reopened, we're going to, and I think we will, we're going to still have to practice really good health habits. We're really going to have to be on the prevention end of this. And until a vaccine is really produced, we are going to have to be very careful. I know this. I think people are going to hopefully continue to wash their hands more frequently, potentially wear masks in certain places, and at the same time, be cognizant of contacts and cleaning surfaces and getting rid of all viruses, not just COVID-19, but you have the flu. We don't want to have cases of the flu. So I would say one word, if we come through successful opening things up, let's still be cautious.
And Steve, that perfectly sets up the rest of this program. Coming up next, Dr. Veer Vithalani. He's the interim medical director of the metropolitan area EMS system. Do you think he knows just a little bit about keeping surfaces and environments clean? And he's going to tell us how people are unnecessarily not calling 911 when they have true medical emergencies. That's next on the human side of healthcare.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome to the human side of healthcare. Steve Love along with Thomas Miller. And we've been talking a lot about COVID-19 and a real focus on COVID-19. But there's something else that our listeners really need to know about. Some people are so concerned about COVID-19 that they are reluctant to call 911 when they need help. And we're delighted that we have a special guest with us today. His name is Dr. Veer Vithalani. He is the interim medical director for the Metropolitan Area EMS Authority, and he covers a lot of territory, not only in Fort Worth, Tarrant County, but some of the surrounding towns. And he's also known to many of us as Dr. V. Dr. V, welcome to the show.
Thanks very much for having me.
As we look at COVID-19 and its ramifications, and we know how serious it is, let's pivot from that. Why are people reluctant to call 911? And what are you seeing in your role with the Metropolitan Area EMS Authority?
I think the healthcare system has done a great job in the ramp up in the initial response to COVID-19, trying to preserve hospital capacity and preserve EMS capacity for a potential surge of patients. Everyone who was working on this had a singular focus, which was open as many beds and save as many resources as possible, because we were all planning for the worst, which was a large, overwhelming number of COVID-19 patients. So we first noticed this when we were looking at our daily call volume trends. So we started to notice a general decrease in the amount of 911 calls, as well as the number of ED visits in the area. And we started taking a deep dive into this because we wanted to check and see what type of patient was still calling 911 and if there were any different characteristics to the patients themselves that were calling. And the first piece of data that really came to light was the amount of cardiac arrests that we had in the system. So like the rest of our call volume, the number of people who were suffering from a sudden cardiac death was going down. But we noticed some concerning trends within that data, most notably that there were more people being left after attempted resuscitation, or who on arrival of the ambulance and the fire department didn't meet criteria to begin resuscitation because they had been dead for a prolonged period of time. So we started trying to get to the bottom of what it is that may be causing patients to potentially delay calling 911 or delay seeking healthcare. And there's been a number of organizations, both locally and nationally, that have been looking at this. And the overwhelming causes that are coming to light are that people are concerned about, one, using resources that they consider that maybe need to be saved for other individuals, such as patients with COVID-19. There's a concern about catching COVID-19 in the hospital or when they're going to a medical facility. They're concerned about hospital overloading and overcrowding. They're also concerned about some of the appropriate policies put in place by the hospitals in terms of limitations on visitors and the like. And all of that is really culminating in patients either calling 911 and not wanting to go to the hospital and refusing transport against medical advice, or simply not calling 911 in the first place.
Dr. V, I work obviously at the Hospital Council. I'm around hospitals. The one message hopefully our listeners can glean from this is now is probably the very best time if you have an emergency to go to the hospital, because infection control is top of mind for everyone. So you raised some very good points. Unfortunately, if your call volume for cardiac arrest is going up and people are reluctant to call, you must have a higher rate of where the patients are pronounced dead at the scene.
Yeah, that's right. And unfortunately, those patients fall into two categories. Some don't meet criteria to begin resuscitation, so they have what we consider obvious signs of death, meaning that they are so far gone that attempting resuscitation is known to be unsuccessful. And then there's also a slightly larger percent of people who we do attempt resuscitation on, but they unfortunately don't come back, and we pronounce them dead in the field.
I was talking to some of my friends at the American Heart Association, and we're trying to work with them to spread the word also about please don't hesitate to call 911. And they're also investigating evidence that other types of life-threatening diseases, STEMI, stroke, and other types of diseases, folks are just reluctant to call 911. Do you have any anecdotal evidence that would support that?
Yes, so I completely agree. on the national level, there's been some research that's starting to come out showing that overall STEMI and stroke volume itself is down, which doesn't fall into the picture we would expect in a pandemic. This isn't something like trauma that would be affected by stay-at-home orders. And so what we did is we've begun looking at how long it's taking for people to call 911, simply reported to our EMS crews. One of the standard questions we ask is, when did your symptoms start? So we're starting to gather some data to look at, are people really waiting longer before calling 911? And looking at last month, unfortunately, compared to last year, it definitely looks like that time is increasing. So still some information that needs to be researched, but it's a concerning trend.
You know, Dr. V, you and I participate in quite a few calls here recently related to COVID-19, but I remember a discussion, I believe it was last week, where the physicians at our hospitals confirmed everything you said. In fact, they said some of their emergency room doctors were seeing patients that fortunately survived their cardiac event, but they had permanent muscle damage because they waited so long to call 911, and that some of the physicians said they felt like they had rolled the clock back 5 or 10 years because patients were in that condition. You know, it's just, it's one of those things where we've got to get the word out. And as you're talking to quite a few listeners here on KRLD and radio.com and our podcast, what would be your message as a physician to people that need to call 911?
I agree, Steve. You know, I think the adage that's been out there for a while now is don't die of doubt. You need to trust your healthcare system, trust your EMS providers, trust the 911 process. If you have concerning symptoms such as chest pain, shortness of breath, if you have sudden weakness, especially on one side of your body or the other, what we say is time is muscle and time is brain. The longer it takes to get you to definitive treatment, the higher the likelihood is that these symptoms may remain permanent. And so what I would say is the hospitals and the EMS system here have done a phenomenal job being prepared for COVID-19, preparing their infection prevention processes, and planning in ways to keep everyone safe, not just the COVID-19 patients, but those who are coming for their routine, urgent, and emergent medical care as well.
Dr. V, you know, when the EMS personnel respond and they go to a 911 call, what are some of the things that the EMS people are doing to help protect the individual so that it can hopefully alleviate some of those COVID-19 concerns?
Sure. So I think it all starts with a heightened index of suspicion. So we all worry about community transmission, that's person-to-person transmission. And so it starts with our EMS providers having a heightened index that any patient potentially could have COVID-19. So in our response, we've done a few things. One, we ask a lot of screening questions at the front end to try and make sure we can identify patients who are potentially infected. We wear a heightened level of personal protective equipment, which initially looks like it only helps the responders, but it does actually help the patients as well. You know, there's a big concern about asymptomatic transmission, and PPE oftentimes goes both ways. So thankfully in our area, the EMS providers and the fire departments have been using reusable PPE that's sort of more durable equipment that they can clean after every use, as opposed to extending the use of one-time masks like a lot of areas are doing. The ambulances and the equipment are cleaned on an extremely thorough and regular basis. They use all sorts of new and innovative ways to do it, such as UV light, peroxide misting, and that happens pretty much after every call, especially a call that may have had a potentially sick patient inside it. And then in working with the hospitals, we continue that PPE sort of channel into the hospitals, and a lot of the hospitals have set up designated areas where potential COVID patients would be kept. So if you have signs and symptoms, then you are put in an area where you're isolated, not just from other potential patients, but isolated from the rest of the population. And if you're coming in for something that is what we now consider more routine emergencies or non-COVID-19 emergencies, then you're generally placed in a separate area from those patients that may be under suspicion for COVID-19.
And Dr. V is going to stay with us for another segment. And we're going to turn the conversation to what we can all do at home and work if you're returning to keep ourselves safe. Some practical tips from the ambulance to your kitchen and office. That's next on the Human Side of Healthcare on 1080 KRLD
and radio.com.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back. We're continuing our conversation today with Dr. Veer Vithalani from Metropolitan EMS. We're going to talk about how we can kill viruses on surfaces of our homes and offices, much like they do in the ambulances. But first, just a few more questions about the safety of calling 911 if you or a loved one are having a medical emergency. So one of the things about being shut in for so long, and of course everybody has a phone in their hand, and it's just real easy to click on Facebook or Twitter and read stuff, right? And you get all this education. And one of the things you read is that they're not doing mouth-to-mouth resuscitation. So would you fill us in on the resuscitation process so that somebody is thinking, well, why should I bother to call anyway because I read on Twitter that they're not going to resuscitate anyway?
Yeah, so that's interesting. You know, it's actually not part of standard EMS processes even before COVID-19 to do mouth-to-mouth resuscitation. We generally have medical devices such as what we call a bag valve mask, which is a mask that's placed over the patient's mouth and a bag that squeezes air in. And so none of those have really changed. What we have instituted is extra measures to prevent any potential spread during a cardiac arrest. So we have implemented the use of what we call viral filters. So those go on our airway devices and they prevent any virus from being shed out into the house for a patient with potential COVID-19. Other than that, all of our providers are wearing a heightened level of personal protective equipment, and some of our local fire departments, such as Fort Worth Fire Department, has recently purchased some mechanical chest compression devices to help prevent extra providers from being needed simply to do the chest compressions and to provide sort of more safe and consistent chest compressions as well.
You know, there are so many myths on the internet, and I really appreciate you filling us in on what really happens. Okay, another one is typically if somebody is in that type of emergent situation, a family member might ask if they could ride along. What are you doing with that now?
So in keeping with hospital policies, we have been limiting the number of what we call riders that can come in the ambulance itself. And so the main reason for that is to prevent any unnecessary people from being in the ambulance that don't need to be. So we limit the amount of providers that are necessary in the back of the ambulance. And we unfortunately have had to take the step to limit the amount of family members that can ride in the ambulance with us. A number of hospitals have implemented policies where visitors are either not allowed or they're limited to a certain number. Pretty much every hospital I've spoken to have exceptions for near end-of-life situations. And so even though these policies are in place, I think that, you know, especially in dire situations like that, it's still appropriate for you to go to the hospital alongside the ambulance and speak to the staff there about seeing your loved one.
You mentioned peroxide a minute ago. I picked up on that. You said peroxide misting. So for us at home, what are some of the best surface topical type things that we can use to disinfect? Is peroxide a good one?
So the peroxide that we use is actually what we call a vapor phase peroxide. It's a very specific formulation of hydrogen peroxide that's misted. If you've heard about the Battelle unit that has come in for personal protective equipment decontamination that Fort Worth is hosting through a FEMA process, that uses hydrogen peroxide. From a home consumer perspective, I would use your standard home disinfectant wipes. Even though this strain of coronavirus is novel, it dies in a similar way to the normal human coronaviruses. So if you look on a disinfectant pack that you have, such as a Clorox or a Lysol or even an alcohol over 70% solution wipe, if it lists that it can kill human coronaviruses, then it's generally considered safe to use to kill COVID-19 as well.
Now, that's a good point, because we're dealing, again, with a lot of misinformation. You deal with life and death information. So when you disinfect, how long does it need to be on that surface before you could consider that surface rendered benign?
Yeah. So each individual EPA registered chemical has its own time frame. I think the important thing is you have to wipe it enough that it gets wet, for lack of a better term, and then it needs to dry. So most people don't realize that the actual disinfecting process occurs during the drying phase of most of these wipes. And so if you simply wipe something and then dry it with a towel, that's not helping. You need to completely cover it and then allow it to dry. Most of them are in the range of 2 to 3 minutes or so, but it really depends. Generally speaking, in the time it takes to completely dry, it would be considered disinfected.
Let's use the power of the medium of audio here for a second. Let's say that we're at the sink and we're washing our hands. All right, so here we go. We turn the water on, we put some soap in our hands, and now we're washing.
Yeah.
And we're washing. And we're washing. And we're washing. That was about 5 seconds, a little over 5 seconds. Is that long enough?
It's absolutely not long enough. And so the first edit I'll make is that you should wet your hands first before adding soap. And then you should scrub the soap in a every nook and cranny fashion for at least 20 seconds. So what I've been doing with my kids is singing Happy Birthday twice. Which is always fun because kids love to sing Happy Birthday. You can pick any favorite song you have that lasts around the same amount of time and sing that. But you need to make sure that you're not just doing the palms of your hands, but you're doing the backs of your hands, the interwebs of your hands. Your thumbs will frequently get missed as well as your wrists. And so there's some great videos online that show that. I've seen some great examples using oil placed into a gloved hand to show the importance of catching every single part of it. But 20 to 30 seconds is really the time. And it's a lot longer than people think. And it's a lot longer than people remember. But it's important to do it for the right amount of time.
I love this contrast between your world and our world because, again, you're dealing with seconds and minutes, and surfaces absolutely have to be decontaminated in your world for this to work, right? And we're out going to Home Depot and Kroger or whatever, and we're wondering about doorknobs and door handles, and what about when we grab the steering wheel of our car, and how about our phone and this kind of thing. Can you give us some other tips from your wealth of wisdom in this of what we can do around the house to de-virus and decontaminate?
Sure. So we talk a lot about cleaning frequently touched surfaces. So doorknobs, door handles, areas where you eat, or areas where you use like your computer keyboard and mouse. I think if you're staying at home and have no contact with the outside world, then the likelihood of you getting COVID-19 is exceedingly low, and constantly decontaminating every hour, for example, is not really necessary. So generally speaking, we talk about decontaminating these surfaces on a relatively frequent basis. Using your standard household wipes is fine. The one other comment that I like to make is, if you've ever seen hospital workers use gloves, you'll realize that we have a very specific process. A glove is used for a single action or a single item where something may contaminate your hands, and then you immediately remove the gloves and clean your hands. And what I see a lot of right now is people thinking that gloves don't carry what we call the fomites, which is the concerning thing about what lands on your hands from COVID-19, from action to action. So, for example, if you wear gloves from 9 a.m. to 11 a.m. over the course of, say, multiple activities, it's really no different than using your bare hands. The gloves don't add any protection unless you are changing them after each activity. And so what we generally say is it's more important to wash or gel your hands between activities than it is to wear gloves, say, at the grocery store. So what I see is people wearing gloves and picking each individual item off the shelf, and then touching their face, and then touching the grocery cart, and then checking out, and then going back to their car and taking off their gloves. Well, that would have been the exact same process had you been using your bare hands. The gloves themselves don't add any additional protection.
You're talking about portals where we could be exposed while we're still at home. What about packages, mail, and especially groceries that we bring home? I've seen people sneeze in front of an aisle in the grocery store without a mask, okay? So if I bring some Jell-O home and some guy sneezed on it 15 minutes ago, we got a problem.
Yeah, so I agree, and I think everyone has a different level of risk tolerance. I think it is not inappropriate to wipe down or clean your groceries. The important thing to understand about COVID-19 is where it does live on surfaces, it may not live on each surface the same amount of time, and eventually, if you leave something long enough, the virus itself will perish simply in room air. So, for example, if you bought, let's say, a box of cereal and you left it in a room for a week, the likelihood that you would then catch coronavirus from touching that box again is exceedingly low. For the most part, what I've been hearing a lot of people doing is simply taking in the groceries, wiping them down, and then putting them away. There's some decent videos online, one by a physician who shows our sort of sterile decontamination process where you have a dirty side and a clean side. That's what I do at home with most of my items. From a packages perspective, I know we're all concerned about packages that are coming in. I think it's in the similar vein. It would be useful to have a dirty area where your packages are, open them all up, and then dump out the contents into a decontamination area, wipe it down, and then it's clean. That's typically what I do.
You mentioned alive, the virus lives. Does it live? Is it alive, or is it more active?
So a virus is alive as really any other virus. A virus requires a host in order to replicate. So what viruses do by default is they attach onto a cell, they inject their RNA and get that cell to replicate it to then spread to other cells. That can't happen on inorganic material like cardboard or plastic, but it can sit and linger for a while in what we call fomites. Fomites are essentially droplets that have landed on something and have the potential to be picked up and then, for lack of a better term, ingested by either touching your mouth or face or other mucous membranes, and then cause infection. And so it doesn't live outside the body, but it can be viable outside the body for hours to days, depending on which study you're reading and depending on what surface we're talking about.
Thank you, Dr. V. You've been a wealth of information to help keep us all safe. Next, we're staying with this theme of taking the best care of your health during COVID-19, going over to UT Southwestern to talk to cardiologist Dr. Amit Khera. COVID and the heart, next on the human side of healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back to the human side of healthcare. Steve Love along with Thomas Miller, and we're going to continue our theme today of what to do in a medical emergency. We're going to go to UT Southwestern Medical Center, and we're going to talk to a cardiologist, Dr. Amit Khera, who is the professor of medicine in the Division of Cardiology at UT Southwestern Medical Center, and he is extremely active in the American Heart Association. Dr. Khera, welcome to the show.
Thanks so much for having me, and thanks for taking on this important topic, Steve.
You know, we've been talking to different people throughout the Metroplex, especially first responders, and they're distressed that many people are afraid to call 911. And they're actually responding to people that have heart attacks and strokes, and they're responding much later than they think they should have. Can you tell us more about what you're seeing and about heart attacks currently, and what patients should be doing if they're having these symptoms?
Well, right. Listen, I think we all appreciate that during this COVID pandemic, there's been sort of waves. And the first was, just obviously a lot of appropriate fear and concern about acutely ill patients and what's happening in the hospital. But now that things are settling, we're seeing another worrisome trend, and that is people with ongoing chronic health conditions, particularly cardiovascular disease and risk factors of such, really not getting the care they need. Specific to that is heart attack care. And let's spend a minute on that. Heart attack care, the importance is timely care, that getting care quickly is so important in terms of saving lives and minimizing heart damage. And there's been not just reports in Dallas, as there have been several based on EMS companies, but now even published reports of year over year compared to the same time last year, a 38% reduction in activations for heart attack care at major hospitals. That's sizable. And, one possibility is there's fewer heart attacks, but that doesn't seem to be the case. There was another concerning report that patients, when you go from what we call first symptom to sort of contacting EMS or first provider contact, in one hospital, it used to be about an hour or so was the delay. And now in their most recent report, it was up to 5 hours that people were delaying. And that's catastrophic in terms of care. So there's fewer heart attack presentations. And we think it's because people are scared to call and are not presenting. And there's significant consequences. To add to that, you said, what should people do? And first and foremost, I want to assure people, the hospitals are open for business. They want to be there and available for you for heart attack care. They have the capacity to do so. The one thing about the COVID epidemic in Dallas being a little less extreme than places like New York and so forth is we've had the opportunity to learn from those places. We're in close contact with people around the country, and there's protocols now by major societies about how to manage heart attacks and COVID. Every hospital has protocols about safety for patients. So we are open for business and ready to take care of heart attack care. We need to do so, and patients really need to contact their doctors and call EMS if they have any worrisome symptoms.
That's great advice that you've just given us. So let me switch gears just a little bit. Prior to COVID-19 and the pandemic, patients would go to their physician's offices and especially cardiologists for routine visits. But now that people are going to be limited to some of those in-person visits, I know we're gradually opening back up. What do you recommend to patients to continue to address their healthcare needs during this crisis? And is telemedicine part of that solution?
Right. And so this is the second part of the equation. The first is sort of acute symptoms that come on and how people definitely need to call and get care for that. But as I mentioned, this sort of second wave we're worried about, the people that are delaying care or not getting access to preventive care or regular follow-ups with their doctors, we may be seeing them pretty soon for preventable heart conditions. So, in the United States, there's 72 million visits a year for cardiovascular disease as the primary diagnosis, about 30 million for hypertension. So there's a whole lot of visits that overnight were essentially canceled. And so we're really worried about what's going to happen to all these individuals. And, from the patient perspective, first and foremost, CMS and many organizations have really made it quite easy for patients, meaning now as doctors, we are allowed to do telephone visits as part of telehealth. You don't have to have a fancy computer and video, although it can certainly be helpful. We can do telephone visits. So now that we're sort of settled in a little bit, I strongly encourage patients to continue their care with their doctors. Set up those telephone visits, set up those telehealth visits, reach out to your providers if you have any concerns about your health care, if your blood pressure is a little high, if you're having difficulty accessing your medicines. We certainly appreciate in the time of some people losing their jobs and so forth, things may change. And we strongly encourage people not to wait and put off those appointments for 6 or 8 months if there's an issue that should be addressed now. So telehealth is here. It's going to be here to stay. It is a great option. I've had several telehealth visits. I've really enjoyed seeing my patients in their homes and getting to know them in a different light. It's certainly a lot easier than having to drive in. And we can get a lot accomplished over a telehealth visit. We can learn a lot about what's going on. We can certainly troubleshoot and address some prevention needs as well. So I strongly encourage patients to continue those visits, reach out if there's any questions, and don't delay those visits.
One of the things with COVID-19 is social distancing. And we've done that, obviously, to help prevent the spread. But also, it's impacted people's stress levels, impacted their amount of physical activity, and probably their nutrition habits. So what is your recommendation as a cardiologist to keep yourself healthy and look at some of your lifestyle habits as we continue our fight against COVID-19?
That's such an important question because social distancing has certainly impacted all of us and has markedly changed the way that we live our lives. And, I think right now there's not a lot of data to know exactly what's happening in terms of health, but we can all speculate, and certainly, I can tell you from talking to my own patients. First, let's start with physical activity. On one hand, people don't have access to gyms. They don't have access to a lot of the health equipment they have. Fitbit, if you go online, they'll show you nationally their numbers. In the U.S., they're down maybe 15-20% in terms of step counts that people have every day. So this is suggesting that people are perhaps doing less physical activity. The flip side is, I want to stay positive here. When I sit in my home and I look out my window, I see so many neighbors out walking, and so many people, walking regularly, walking their dog, walking with family members, of course, keeping appropriate social distance. But I think we need to strongly encourage people to continue doing that. You may not be able to do what you used to. If you, again, like to go to a spin class, you may not be able to do that in person, but there's so many online options in terms of YouTube videos and other things that are actually free. And a lot of companies have been putting out free material to help during this crisis. Walking is always a great exercise, just as long as you're careful about social distancing. And so that would be important. And then nutrition. And this one's really fascinating because, it remains to be seen exactly the impact, but we do know a lot of people have had some weight gain during this time. They're at home. They're sitting in their houses, especially initially. There's a lot of comfort foods. If you look, Campbell's soup and Goldfish crackers, they've been up in terms of their sales. And so there's a lot of comfort foods. There's increased alcohol sales. People have noted by Nielsen numbers. So we're worried that this may result not only in weight gain, but unhealthy habits in terms of food. But let me be positive again. At least again, talking to my patients, I think people that used to eat out a lot now are forced to cook at home, and many of them are actually getting healthier. I think people are learning again how to cook as a family, how to eat together. And I think in this time, it's really important to learn how to make good choices and to cook highly nutritious food. There's many options now. At first, there was a little bit of scarcity around some food items, and I think that's gotten a bit better, and we can get most things in terms of including produce. So I think we just have to be creative about it. We appreciate people can't go to the grocery store every day and so forth, but I do think there's many ways to keep healthy, and especially I am at least encouraged that people are learning how to cook again, many people who hadn't been, and that's a great way to keep us healthy.
And staying healthy like that will help boost your immune system as well as your cardiovascular system. There's a double win. Dr. Khera has more great information for your heart, and we'll be airing that next week. And a special shout out to all the moms out there. We're sending you love on this special Mother's Day, and thank you for bringing life into our world. Happy Mother's Day. Have a great week. We'll see you again next week on the human side of healthcare.